Hi, I'm John Kalarickal. I'm one of the gastroenterologists here at Gastroenterology Associates of Gainesville. Originally from Atlanta, grew up and went to high school, mostly in the Gwinnett County area. Following that, I went to Georgia Tech and did the first 2 years of my undergraduate, after which I transferred to the University of North Carolina at Chapel Hill. After that, I've moved around quite a bit doing my medical training, most recently finishing my gastroenterology at Tulane University in New Orleans. We decided with my family to move back following our training to be back closer to home in Georgia and join the Gastroenterology Associates in Gainesville, mainly to be in an area where there's plenty of outdoor activities and to be part of a group that I find has a wonderful group of physicians. So we're happy to be back here and be part of the Gastroenterology Associates of Gainesville family. So today we're going to talk a little bit about acid reflux, heartburn, or GERD, which is kind of the common acronym for what is termed gastroesophageal reflux disease. Acid reflux is actually the pathology of what's happening when the contents of your stomach, including acid, are pushed up or regurgitated from your stomach into your esophagus, creating the symptom of heartburn and other symptoms. And the chronic form of that is what we call GERD, or gastroesophageal reflux disease. So acid reflux can manifest with many different forms of symptoms, the most common of which is what we call heartburn. And heartburn is sort of a misnomer because it actually has nothing to do with your heart. Instead, it's that burning sensation that you feel when acid refluxes into the esophagus and gives you that pain or discomfort either in your upper abdomen or in the chest area. Other common manifestations of heartburn or acid reflux are regurgitation, sour taste in your stomach, nausea, belching or burping, and sometimes can even be associated with upper abdominal discomfort or a sense of intestinal upset. So the more severe form of acid reflux, or chronic form, is what we call GERD, gastroesophageal reflux disease. And that can be manifest with some more significant symptoms, including chest discomfort, difficulty swallowing, hoarseness, or sometimes with a lump in your throat sensation. So there's some simple do's and don'ts that may help us to improve our symptoms of acid reflux. And some of the main things that we don't want to do, for example, are wear tight-fitting clothing, which may compress your belly and then therefore increase the likelihood that you may have further regurgitation or pushing upon your stomach to induce more acid reflux. Other things that you don't want to do is eat large meals, which may fill your stomach more and make you more likely to reflux. And then certainly laying down or sleeping soon after a meal will again induce the likelihood that you'll experience reflux symptoms at night. So those are some of the big things that you don't want to do. As far as the things that you do want to do, is lose weight. Obesity is associated with worsening acid reflux. You want to eat smaller meals. As far as when you sleep at night, if you have chronic reflux type symptoms or heartburn symptoms at night, sometimes elevating the head of your bed or sleeping on a wedge may reduce the symptomatology of acid reflux. So as you can see, there are some simple things that we can do that can really improve our acid reflux or heartburn symptoms. But if it's left untreated, more serious things can happen. You can develop narrowing of your esophagus, which can then lead to difficulty swallowing. You can develop bleeding from your intestines because of esophageal ulceration. You can develop chronic hoarseness or chronic cough. And one of the more severe or concerning things related to acid reflux is some people with chronic acid reflux are going to be prone to a higher risk of esophageal cancer. So if any of these symptoms persist, if you have any worrisome symptoms, you should talk to your doctor, come up with a treatment plan, and figure out how do we best treat or diagnose what's going on.